Come in.
Hi.
Hi.
My name's Greg. I'm going to be your nurse for this afternoon.
Hello.
So what we're going to do today is I'm going to test your hypoglossal nerve, which is your 12th cranial nerve.
Okay.
It's a motor nerve that controls your tongue.
Mm.
So we're just going to check that and make sure it's working properly.
Okay.
So first thing I'm going to do is have you stick out your tongue for me. Okay?
Mm-hmm.
Can you move it side to side? Good. Alright, now I'm going to take a tongue depressor. I'm just going to put it on your tongue and I'm going to ask you to resist me, okay?
Okay.
Go ahead, stick out your tongue. Go ahead and resist. Good. Okay. So your 12th cranial nerve is operating just fine.
Okay.
Come in.
Good afternoon.
Hello.
My name's Greg. I'm going to be your nurse for this afternoon. So what seems to be the problem?
Well, I have a recent neck injury, and ever since, I haven't been able to talk right. Swallowing's been difficult, and I've had some problems with my tongue.
Okay. Has your tongue felt weak, or have you had any difficulty speaking, chewing, or swallowing?
Yes, to all of them.
Okay. In that case, I'm going to check your 12th cranial nerve, which is your hypoglossal nerve. It's a motor nerve that controls your tongue. Alright. So the first thing I'm going to have you do is try to stick out your tongue. Yes? Okay. Are you trying to center it right now?
Yes.
Okay. Can you move it side to side?
Uh-uh.
No? Okay. Next thing I'm going to do is I'm going to use a tongue depressor. I'm going to press down your tongue and I want you to resist me, okay? Go ahead, stick out your tongue again. And resist. Are you resisting?
Yeah.
Okay. Alright. Based on those findings, I think you have something wrong with your hypoglossal nerve.
Okay.
Now, this could have been caused from the injury. Also, common causes are stroke, a tumor at the base of the skull, bone abnormality, infection of a brain cell, neck injury like the one that you have, or Lou Gehrig's disease.
Okay. So are there any treatments so I can talk normal again?
There are several treatment options. One for possible neck injury would be microvascular decompression surgery. But since there are so many causes, we'll need to do further tests to see what was the root cause of your cranial 12 injury.
Okay.
The hypoglossal nerve is the 12th cranial nerve, which operates the tongue, and it's a motor nerve. And it gets its name from the Greek word hypo, which means under, and then glossal, which means tongue. So it's underneath the tongue. And it mainly controls the motor functions of the tongue. And some causes of hypoglossal nerve damage would be if you have a stroke, a tumor at the base of the skull, bone abnormality at the base of the skull, infection of brain cells, a neck injury, or Lou Gehrig's disease. The damage of the hypoglossal nerve could result in the tongue becoming weak and atrophied, and results of tongue atrophy can lead to difficulty with speaking or chewing and swallowing. So, in the first assessment, Nurse Greg assessed a person with a normal hypoglossal nerve. She was able to move her tongue from side to side. She was able to stick her tongue out without it deviating to the left or right side. She could resist the tongue depressor when Greg pushed against the tongue. But during the second assessment, Nurse Greg assessed a patient who had suffered a neck injury and it affected his hypoglossal nerve. So in the assessment, the patient had trouble speaking and eating and swallowing, and he also couldn't perform the assessment tasks such as sticking out the tongue sticking out the tongue straight. He couldn't move it from side to side, and he couldn't push against the tongue depressor.